Hi, my name is Olivia. I'm going to be talking about Maddie Clark's head and neck assessment video today. First, a couple things that I just want to mention. Maddie, great job. Overall, you were very professional. You gave good subjective data overall. Let's see. I liked how you explained what you were doing and what you were checking before you actually did it. That was a really good thing in my opinion. I will mention that some of the parts of the video were kind of low to hear, so maybe in the future just bring your laptop a little bit closer. That's what I had to do because I have a Mac as well. When assessing the eyes for vision, I noticed that you didn't ask any questions about like blurriness or double vision. Maybe just something that you would like to add in because those are important factors when assessing the vision. I did notice that you, when mentioning like the conjunctiva, you just said that it was clear. Was it pink? Was it red? Infected? In reference to like the eyes for the subjective data, you said that you would use the Snellen chart to assess cranial nerve number 1. It's just a simple mistake. Just don't forget it's cranial nerve number 2 for vision. And I did also notice the palpating the sinuses. I didn't see you do that. Maybe I missed it. For the oral exam, I did note you didn't mention the tonsils, but you did do a good overall oral exam besides that. For assessing the breweries, I liked how you told the patient to blow, take a breath in and blow out and then hold. But a good technique for us as like an examiner would be to hold your breath while you're assessing them, so then you know when your patient needs to take a break. I did like how you did the range of motion and like the wrist and fingers, but don't forget about like the range of motion in the shoulders, which I think you did mention later on in your video when you had Morgan standing up. I will say for like the pulses, you did overdo yourself. Good job though. We didn't have to do them this time, but I do like how you did them and you explained and went down and did each of the pulses. I will note that I didn't hear you mention anything of like paresthesia or like any neuropathic pain. So maybe just some things that you would want to ask when like assessing like the legs and the arms. I see that you did not have Morgan do like the heel down the tibia. So maybe just put it in like your next video. And then like the supination and pronation of the arms. But I did like, as I mentioned before, your range of motion exercises. They were really good. And I liked how you gave a breakdown of like the cranial nerves and everything you did at the very end. It like solidified all the information. So my question to you would be, when checking inside the ears, what would you use? What's the tool that they use? And what would you look for? Have a good day.